chair this session. And as you know, COVID pandemic is reaching on and we are in for a long haul. So this session regarding COVID disease and tobacco control is of great relevance. And I think it would be interesting in this session if we can throw some light about effect of tobacco use on progression of the COVID disease and morbidity. And with that, I would like to invite Dr. Rakesh Gupta. He's President and Director of Public Health Strategic, Public Health Education and Research. He's the former DHS and Director of Chemical Examiner Lab. He's alumni of John Hopkins School of Public Health, Baltimore, University of California, San Francisco, and he has received recognition for WHO Award in 2015 on Tobacco Day, and he's represented Ministry of Health and Family Welfare for a consultation in Panama in 2016 and in Geneva in 2017. Welcome, Dr. Rakesh Gupta.
Thank you, Dr. Amandeep, and cheers. So I'll be talking about the COVID and its correlation with the tobacco use. Yeah, next. So we, as all of us know, that tobacco use, it's a major risk factor for the four main non-communicable diseases: cardiovascular diseases, cancer, chronic lung disease, and diabetes. And all these diseases together, they put people into higher risk for developing severe illness when affected by the COVID-19. And as we all know, the NCDs, they are estimated to account for 63% of all deaths in India. Next. You're next. So smokers, they are likely to be more vulnerable to COVID-19 as the act of smoking means that fingers, they are in contact with the lips, which increases the possibility of the transmission of the virus from hand to the mouth. And experts, they have confirmed that smokers are more likely to develop serious symptoms or even die from COVID-19 as it primarily attacks the lungs. Further, smoking that products such as water pipes or hookah often involve the sharing of the mouthpieces and hoses. As we all know that the hookahs, they are used, it's a social activity in villages also and in hookah bars as well. Next. Now it is a well-known fact that smoking of tobacco, as maybe as cigarettes, as BDs, as hookahs, or even as non-tobacco product, pure nicotine products like electronic cigarettes, they would increase the chance of COVID-19 infection and the progression of the deadly disease. Smoking, as we all know, that reduces general immunity and reduces the cell-mediated immunity. Smoking also reduces the motility of the cilia that cleans and defend our lungs. So it is clear that the COVID-19 as well as smoking directly and seriously affect the lung health. Next. So there was a large study held recently in China in which there were 1099 patients. And the data shows that among the severely affected patients, almost 17% they were current smokers and about 12% were among the non-severe. Among these reaching endpoint, so almost 1/4 were current smokers and 7.6% were former smokers. So it shows that smoking really affects the vulnerability to the infection and the severity of the infection. Next. There's also a misconception among the general public that water pipe or the hookah smoking is less harmful than a cigarette and e-cigarette smoking, as these are also affect the lungs health equally. There are at least 82 toxic chemicals and carcinogens in the hookah smoke. The heating of the charcoal that used to heat smoke in hookahs, that poses another health risk because of the presence of the carbon monoxide, metals, and other chemicals. And as I mentioned, the hookahs being a social activity, so single mouthpiece is being used by many people, so transmitting infection from one to other. Next. So it is another misconception that e-cigarettes are a safer alternative, as we all know that in 2019, many people they lost lives due to e-cigarette use or vaping product use associated lung injury, which is commonly called as EVALI. So more than 100 people actually they lost lives primarily in America. We need to be conscious about the unproven claims in media that tobacco or nicotine could reduce the risk of COVID-19. As per the WHO, there is currently an insufficient information to confirm any link between tobacco or nicotine and the prevention of treatment of COVID-19. Rather, the use of tobacco and nicotine that enhances the risk of getting to COVID. Next. And COVID is another opportunity for cessation. So Dr. Rakesh Gupta from Jaipur, he will be dealing with the cessation part. So we have a quick line number 1800112356, and it should be publicized by all the doctors, by all the hospitals, so that the people, they start using this facility for cessation. And another thing is that even the smokeless tobacco, that affects the outcome of COVID. And Dr. Amit Yadav will be dealing with the smokeless tobacco and COVID. Next. So many thanks for your attention. And so other part of the subject will be covered by subsequent speakers. Thanks a lot.